FAROS, which stands for Functionally Accurate Robotic Surgery, is a European project that started on January 1, 2021, and that will last for 3 years. The lifetime prevalence of low back pain is 84%, so you might have already suffered from it, or undoubtedly you know someone who is wrestling with it. Low back pain is a huge societal burden that causes 60 million disability years worldwide. Especially in Western countries, the rate of spine surgery increased considerably over the last 20 years. Therefore, the role of spine surgery in our life is inevitable. Pedicle screw placement, in short PSP, and endoscopic lumbar discectomy or ELD, are among the spine surgery procedures. Spinal fusion is a common type of surgery that involves pedicle screw placement. It may be performed in case of spinal deformity, degenerative condition, fracture or breaks, or other issues causing back pain. The objective of spinal fusion is to fix the vertebrae, with respect to each other, by grafting and fusing into a single structure, and as such reducing or getting rid of the pain. Endoscopic lumbar discectomy aims to remove the damaged portion of a herniated disc in the spine. A herniated disc can also be called slipped, ruptured, or bulging disc, and occurs when some materials inside the disc push out through a crack in the more rigid exterior. So, the discectomy is performed to relieve the pressure on the spinal nerve. Of course, there are numerous challenges in spine surgery. Visualization is very poor, and this while the spine is nearby vital structures, like nerves and vessels. Conventional navigation systems may give the surgeon a wrong impression of safety, due to the high geometrical precision that does not equate to functional accuracy. Furthermore, they suffer from technical limitations and complicate the workflow. Intraoperative radiative imaging techniques may be employed to circumvent, but they are not perfect either, and the radiation itself is damaging not only for the patient but also for the surgeons. All these challenges cause complication rates to be as high as up to 18% for pedicle screw placement, or PSP, and up to 5% for endoscopic lumbar discectomy, or ELD. Experienced surgeons have way lower complication rates, but if there are complications, they will be severe. Functional accuracy is defined as the degree to which the outcome of the surgery conforms to the expected outcome for a successful and complication-free operation that forms the functional objective. In surgery, the aim is to maximize functional accuracy, not the overall accuracy. For instance, in pedicle screw placement, a screw should be placed in the pedicle to provide maximum stability without causing a breach. Therefore, for example, a slight deviation from the predefined plan for the screw should not always be penalized because it may not affect the functional outcome. It is FAROS' ambition to introduce functional accuracy in surgical robotics. We will identify the key parameters contributing to the functional accuracy and utilize them to improve the outcome. Also, FAROS will reduce the need for preoperative planning and remove intraoperative radiation. FAROS shall develop smart instrumentation, which provides a profound understanding of the surgical scene using a set of non-visual sensors. The non-visual sensors will operate in real time to capture features of the surgical scene that can be associated with functional parameters. Functional models exploit the sensor signals online and determine the functional parameters, such as the tissue type that is in contact with the tip of the surgical instrument, the insertion depth, or even the stability of screw placement. For instance, the tissue types could be identified using an oscillating instrument based on vibration responses because the vibrational or vibroacoustic behavior of a structure reflects its mechanical parameters. Also, breaches could be detected using feedback from electrical impedance sensors because the conductivity of the spinal cord, blood, and bone would be different from each other. Finally, functional controllers receive the output of the functional models and produce sensible autonomous robot actions to maximize functional accuracy. FAROS Consortium consists of 5 partners: KU Leuven in Belgium, SpineGuard in France, King's College London in the United Kingdom, Sorbonne University in France, and the University of Zurich in Switzerland, as well as its affiliated University Spine Center at Balgrist University Hospital. One of the ongoing research projects develops a robust force controller for the stable interaction of the robot with the environment. Herein, you observe that the design controller is stable and robust to external disturbances and changes in the environment. For instance, when an operator moves the end effector of the robot or taps on it, the robot can exert the desired force stably. Also, changing the environment from a hard one, metallic plate, to a soft one, spring, does not alter the robot's performance. Another research project extracts and isolates camera motion from image data of a dynamic scene. This goal was achieved through supervised training of a deep neural network. This work contributes to automatic positioning of a robotic manipulator in the dynamic surgical environment. In another ongoing project, we investigate and collect data from contact microphones placed directly on the samples. Using an optical tracking system, we can acquire the exact location of the drill tip with respect to the anatomy. The coordinates of the drill tip serve as the reference labels for audio signals, which can be implemented within the deep learning-based approach, for identifying tissue type from vibroacoustic signals during surgical interventions. Another further project develops a functional model for automatic breach detection using electrical impedance sensing. The image shows the setup for a test of the functional model. The drilling is directed toward the spinal canal of a lamb vertebra. It stops automatically once close to breaching into the spinal canal. Herein, the frequency of the beeping sound indicates the level of electrical impedance. Also, another study develops ultrasound-based three-dimensional bone reconstruction. The Accurate RObotic arm moves the ultrasound probe over a bone model. A three-dimensional reconstruction of the bone can be seen on the laptop screen. Here, you see the current version of the FAROS robotic system for pedicle screw placement. The sketch demonstrates the robotic system that performs an ex vivo test while drilling in a lamb vertebra. The first robotic arm, a Accurate ROmed, on the left, holds a power drill equipped with a built-in torque sensor. The drill bit is equipped with a sensor that measures the tissue's electrical conductivity at the tip of the drill bit. Also, two accelerometers attached to the vertebra measure the vibrations while the robot is drilling. The second robotic arm, a Panda Frank-Emica, holds a hyperspectral camera and a microphone. This robotic system drills in the vertebrae so that the pedicle screws can be inserted, attaining the functional objective of maximum stability. All these sensors are integrated, maximizing functional accuracy. Based on real-time sensor signals, functional models will be evaluated, and drilling motion adjusted to guarantee that a breach either in the spinal cord or outside the vertebral body will be avoided. FAROS foresees in a series of integration weeks to synchronize and combine the different research projects, to integrate sensors, functional models, and functional controllers in a single unique robotic system. During these integration weeks, all the partner institutes meet and integrate the research and development conducted at their institutes into a single powerful drilling platform. The program consists of scientific sessions for presenting the latest results, tutorial sessions to share know-how, technical sessions for testing the developed hard and software, and experimental sessions. These photos show the last integration week conducted at Sorbonne University. For more information regarding the FAROS project, we invite you to visit our website at h2020faros.eu or follow us on Twitter at h2020faros.